publicly stating what you're just seeing in the hospital, in this instance, really is an act of courage. All right. Well, we have Dr. Russell Surasky with us here today. He's a double certified neurologist, one of the only few physicians in the United States certified in both neurology and preventative medicine. Practices within the Northwell Health System in New York, where he specializes in complex neurologic pain, headaches, spine disorders, and challenging diagnostic cases referred by other physicians. So he's there when the other physicians can't treat it. They go to Dr. Surasky. He's the author of the best-selling book, This Book Will Save Your Life, and a frequent contributor to Fox News and News Nation. Welcome, Dr. Surasky.
Thank you so much for having me.
It's a pleasure. And thank you for making the trip out and sitting down with me today.
You know, I got to tell you, I'm asked to go on national news all the time to speak on a number of pressing health issues. But I think right now that there's probably not one other medical issue that more people face in this country than this vaccination issue.
Well, when you say the facing, are you talking about medically? You're talking about rights? What are you referring to?
All the above. Because if you think about it, who is exempt from being potentially hurt? One, you have to worry about the potential risks of the vaccines, which we'll certainly go into, benefits versus risks like anything else. But the problem is that there's essentially no education going on from their physicians about the risks for the vaccines. There's basically no informed consent happening because they're not educating the patients as to how to weigh risks and benefits. And then, what family is not impacted because everyone's essentially mandated. If your kid can't go into the public school system, there's a strong coercion there. So that leaves us in a situation where what family isn't touched right now, and there's a huge divide that I think is a false divide a little bit, where people are sort of planting their stakes in this country.
Well, you're speaking to my heart. You know that. I couldn't agree with you more. I mean, there is no family that isn't impacted this because virtually everybody in America is subject to at least a mandate to attend vaccines, to attend school. That's crushing on individual and civil rights. Persuade them on the merits, and if they don't want it, they shouldn't have to do it. And obviously, there are sequelae and consequences to vaccination, and folks don't really understand that. Now, you're a medical doctor. You've been practicing neurology for how many years?
I've been out of residency about 11 years now.
Okay. And so, you just said vaccines can cause harm, obviously. Those words don't typically come out of most medical doctors' mouths as readily as you said it. You said it clinically almost. Most doctors would have a very emotional, difficult time in saying those words. How did you turn the corner? How did you come to have what I will say sounds like it might be a more objective view about these products and maybe even treating them as products?
Well, to be honest, I didn't think much about vaccines throughout all of medical school. It wasn't until I got into my neurology residency at Northwell where, residency is where, you're in the hospital, you're in training, you're on call every 2-3 nights for 30 hours straight. And it was there that my eyes really opened to what is the truth, which I'm going to get into with you now, which is that, I'll never forget, it was my first time I was actually on call in the hospital. And neurology residents, we race around the hospital running as fast as we can because there's a lot of strokes that happen. And when patients come in with strokes, time is brain, as they say, because we have clot-busting drugs. And if you get them into people quick enough, you can break open those clots and oxygen can get to the brain. And so, code strokes are going off all the time. And we're running like the wind to see patients. And so there's a code stroke this one night. And my very first night. And
how many years into being your residency?
I was in residency. It was my first year. First on-call night.
First on-call night?
Yes.
Okay, keep going, please.
First on-call night, code stroke, it was the third one of the hour, right? So I'm running to the code stroke, and they already have the person loading into the CAT scan machine that they have to get done right away to make sure it's not bleeding in the head. And I can already see there's something not typical about this case. In neurology, we're looking to localize where the problem could be in the brain. We're looking at patterns of weakness, numbness, and I could see right away that this was something very unusual. So when they pulled him out of the CAT scan, they're about to get the TPA, the medicine going for the stroke, and I told them to stop it. And I explained to them that something didn't look exactly kosher here about the stroke. I was examining the patient, and they had signs of this condition called Guillain-Barré syndrome. Now, I had never seen a case myself. I've learned about it in medical school, but I've never seen a case myself until that moment. But it was clear that that's what was happening. He was a guy in his mid-30s, otherwise healthy, and I'm watching him. He's paralyzed, basically from the knees down at this point. And it just had started a few hours before when he couldn't move his feet. Now he can't move from the knees down. So, and all the signs were pointing to this syndrome. So I said to him, "You didn't by happen chance to get a vaccine, did you?" And he said, "Yeah, I got the flu vaccine like about 12, 13 days ago." So bingo, went right off in my head. They always teach it to you in medical school, and everyone sort of forgets that that's the number one or two cause of syndromes like this. I said, "Okay, I know what to do. We got to rush you and got to give you the special treatment IVIG that could save your life." So that's what we did. And he did have to be intubated because unfortunately it moved too quickly to get him before that. But he was eventually extubated with no neurological deficits. So everything went fine in that case. And I remember 10 years ago going home saying, "Wow, can you imagine I saw this rare case? It was my first time on call." And little did I know that the following week, I saw another case. And the following week, I saw something akin to it, encephalitis. And then I saw transverse myelitis.
Encephalitis meaning brain swelling.
Brain swelling, yeah.
Yes. And for those that don't know what you were saying, Guillain-Barré syndrome, GBS, that's where, if you want to explain it.
Sure. So what all these syndromes have in common that we're going to talk about is the immune system becomes hyperexcitable, so to speak. And it mistakes the protein or the antigen or the vaccine for being its own, it confuses its own natural tissue, the brain or the nervous system tissue, with the vaccine that it's attacking. And so it crosses over, it attacks both. So now your own immune system is attacking your brain or your spinal cord or the nerves. With Guillain-Barré, it's attacking the nerves. In encephalitis, it's your brain. And in myelitis, or transverse myelitis, it's your spinal cord. And so it's all from the same cause, though. And
it's all from your immune system attacking your nerves. That's right. Whether, as you were saying, GBS starting in your extremities, in transverse myelitis starting in your spine, or encephalitis starting in your brain. So, all right. So your first day in residency, you're seeing a case of GBS. A week later, you said you saw another one. A week later, you said you saw encephalitis. Then you said how long after that was the transverse myelitis?
We're going back 10 years, but ultimately, when I get to it, I was going to explain basically that this became the norm. It became the norm of what I saw in neurology residency. And I did internal medicine. You have to do a year of internal medicine before you go into neurology. And internal medicine, I didn't come across this. So it dawned on me after seeing this so many times, why, also, when I would talk to my other residents in neurology, especially the upper ones, they didn't balk at this at all. And I presented
balk at
the fact that I had all these cases. They said, "Yeah, you're going to keep seeing them."
From vaccines.
Yeah.
And did they ask if the person had been vaccinated? Did they associate with vaccinations? Or was that something you happened to be doing unlike others?
Well, we were always alone when we were on call. So, that's just how it was. One resident's on call for this huge hospital for neurological cases each night. So I was by myself, so I don't know who asked and who didn't. But there's a number of reasons how you basically can figure out what it is. And we can get to that. But they weren't surprised at all. And then even more so, what we'd have morning rounds because I'm in the hospital by myself. Then I would call, in the morning, we talked to our attending doctors, the actual practicing physicians who were overseeing us, and we would present cases to them overnight, and they didn't balk at all at the cases. So I'm saying to myself, wait a minute, no one seems to think that this is unusual, because I know that on the boards, the licensing tests in medical school, everything that I taken and did very well on. This was rare. So
I mean, it was taught to you as being rare.
Very rare.
But yet, in the clinic, it was not rare at all.
In the hospital. Yeah,
in the hospital.
Yeah. And well, so far it wasn't rare what I was seeing. So
and your experience, you're saying, was not surprising to others who were in the hospital. They were like, yeah, this is normal. Wow.
Yeah.
Okay.
So obviously, why?
And just to be clear, you're just talking about neurological reactions to vaccines because that's what your specialty is. You wouldn't have seen any other issues with vaccine, just the neurological issues.
Severe neurological ones that
Severe
come to the
ones.
hospital.
Okay,
Yeah.
right. Okay, please continue.
So essentially, what happened is one day I didn't know about their system reporting injuries to vaccines. We don't learn that in medical school. I never heard of it. And here I am, a neurology resident, treating these cases. But until one day I started doing my own research, I'm saying, like, I gotta look. Why does it say it's so rare when I see these things every time I'm on call? So,
and up to this point, up until you saw these cases, had you ever had any negative thought about? Did you just think vaccine injuries were 1 in a million until that point?
Yes, that's how it's taught.
That's what you were taught, 1 in a million.
Yeah.
And you had no other reason to doubt
the
that.
sum total that you learn in medical school about vaccines goes like this. Basically, they teach you the basic immunology as it's taught behind how vaccinations work, and you're taught that there are very, very rare side effects of any significant consequence, and memorize the schedule. That's what you have to do. Memorize the schedule. And from then on, they only ask you, well, on tests, what vaccine do you give it this month? What vaccine do you give it? It's never even.
Do they ask you to memorize the precautions for when you shouldn't vaccinate?
Not only do you not have to memorize them, I don't even remember being taught them.
Okay, let's get back. I knew the answer to that question.
Yeah.
Because I've talked to a lot of folks from medical school. Okay, moving back to you're back in your residency. You're a few weeks. You're You're seeing all these serious neurological complications from vaccination. Mm-hmm. Please.
And by the way, not all the cases had happy endings like that case. When you look at the literature, it's about 25% of people actually die with these conditions. And if not, they wind up with serious permanent neurological deficits, or they wind up intubated indefinitely. So these are very severe things. You have to use life-saving treatments in the hospital, either intravenous immunoglobulins or another treatment called plasmapheresis, which is what we have to use on all these patients, which is basically you're dialyzing them. You're flushing out the antibodies that are attacking their own antibodies, attacking their brain or spinal cord, and you're giving them new antibodies. With intravenous immunoglobulins, you're actually taking healthy antibodies from thousands of people, and you're basically flushing out their system with them. But if you don't get that in fast enough, what happens in some of these conditions is they just decline so rapidly. We're talking in front of your eyes, hours, days. We'd intubate people just because we don't know how fast it's going to go from their feet up to their lungs and paralyze their diaphragm and have them stop breathing. So, that's how fast we had to act when they came into the hospital. And so, when the attendings, so I learned on my own about this, reporting systems and that kind of stuff, just happenstance. And so one day I asked one of the attendings on a particularly brutal case, which was clearly a vaccination case. And it was a 13-year-old who happened to get several vaccinations, not even a child, several vaccinations. It was about 4 days later.
Do you know which vaccines?
I don't know exactly which ones. They were coming from another country, and they were catching up on getting a whole bunch.
Got it. Please.
And it was an adolescent, and they had severe neurological problems happening to them, and paralyzed from the waist down, but also having clear brain problems. So it turned out that this person had acute demyelinating encephalomyelitis. Which is a long-term for basically all the above are getting hit, the brain, the spinal cord, and it's like they say it, they ask you on the test, it lights up like a Christmas tree pattern, meaning it's just like all over the spinal cord and the nerves. Because what happens is, fortunately, at the hospital we're at,
and when you say lights up, you see inflammation everywhere.
Yeah, and the way we do that is, unfortunately, in our hospital, we have a lot of all the most advanced tools at our disposal. So we get them right into 3T MRI scanners, and we use contrast. And the contrast tells us relatively how recent is the attack here. And so when we use contrast, if contrast lights up, it means that the blood-brain barrier, the cerebral spinal fluid, and sort of the barrier to the attack has been opened up and is being attacked right now. So we can see if the attack is happening in real time. And so that's what we see in these cases, by the way. And so you see it light up like a Christmas tree, basically, the spinal cord and the brain. And we see these cases, and the outcomes can be really catastrophic. It's really heartbreaking to see this. And it was, and I've seen ADEM, acute demyelinating encephalomyelitis, after one vaccine. And so sort of the adage that like, oh, if you space them out, or you only do one, or you only do, like, that's not necessarily going to protect you. And so not to get too far ahead here, but with the going back to the attendings that I would present the cases to, they seemed very nonchalant about it. In fact, behind closed doors, they would use these cases to teach us to be aware of the vaccine injuries. But it's sort of like, but then it's not really discussed much, outside of teaching, on morning rounds. We don't really hear about it. One of the major issues I learned early was that when I would ask the attending, hey, do you ever, that was one of those cases I just told you. And I said, are you going to report this case? And they kind of looked at me like I had three heads. What do you mean, to who? And I said, well, there's these databases like VAERS.
Which is the Vaccine Adverse Events Reporting System. Yep.
That's right. And so they said, well, first of all, they thought it was strange that I was asking. I probably was the first person ever asked that question, it looked like. And they said...
Did they know what it was?
They did actually know what it was.
Okay.
And they said, well, first of all, and they then began to give me a litany of reasons why not to do it.
And what did they say?
Well, the reasons are, one, we have a lot of patients to see. You can't sit down for an hour and fill out paperwork. Where's that going to get us anyway? Two, and they'd say something along the lines of like, you can't, they want a lot of proof that you can show us exactly it's the vaccine, and how do we really know? Now, in truth, we all knew, but for whatever reason, maybe it made them feel better about themselves to say like, we don't really know, but we knew. And then the other reason was essentially like, kind of understated. It was sort of like, well, what do you want to go sit before the conference at the hospital and have to explain this, like why you reported, or and I kind of took from it with his liability, So these reasons, by the way, those reasons, the fear of liability, the fear that you're going to be sitting in front of, all the vice presidents of the hospital or whatever it is, and quite frankly, unpaid time to sit there and fill out paperwork when doctors are underwater trying to see patients, and that's the truth. That's the biggest reason is you can't stop for 5 minutes. How are you going to stop for an hour and fill out this paperwork? So, but that's when I realized, okay, this isn't my hospital. These are systemic disincentives for reporting. So I knew right then and there, this is going on across the country, and that's when the light bulb went off, and I said, this is scary.
They can automate the tracking of every vaccine almost nationally. They automate tracking essentially every vaccine given, right? They have state immunization databases, so they know the vaccination status of every kid in each state, right? They've automated everything with regards to vaccines, right? Almost. But when it comes to the injuries, to your point, they have purposely kept it this antiquated system where the doctor has to spend an hour to enter it. Obviously, the reason the federal government does that, the CDC and the FDA, those who have jointly administered the VAERS program, transparently because they want to disincentivize doctors from doing it. I don't know if you're aware of this. There was, I'm sure you know about the 2011 Harvard Pilgrim study funded by HRQ, which automated VAERS reports receipt and, at Harvard Pilgrim. And after they've created the system, CDC wouldn't cooperate with them to integrate it into VAERS. Anyway, let me ask you this. Do you think that the folks in the neurology department that you worked with, those attendants, those physicians who saw these serious complications of vaccination and knew it was from vaccines, do you think that they maybe were more likely to decline or air squirt their annual flu shots for themselves or for their kids?
I mean, I'd be speculating, counselor, on that one. I mean,
Well, I don't want you to speculate.
Yeah.
I don't want you to speculate.
Well, no, I mean, yeah. But that Pilgrim study, by the way, isn't that same? Didn't they look and see that or you'll know the details better than I will, but it was something along the lines of like less than 1% of.
Yeah. So what the Pilgrim found is that they had about 300,000 folks that came through, and amongst them, when they did it in an automated manner, they found about 30,000 reportable events to VAERS. And what they said in that report is that less than 1% of adverse events after vaccination are reported to VAERS. Less than 1%. And to your point, you're not talking about like a little arm pain. You're talking about serious neurological complications. And even there, did you know of any physician, other than yourself, presumably, who actually ever reported to VAERS any of the serious complications you saw or knew about?
No, I've never spoken to one that did. Which is why I wasn't surprised. When I heard that statistic, I said, well, if you're coming in and nearly dying and no one's reporting it, you know, and that's when I realized this systemically. So
Yeah.
what I just going downstream for a moment here, when you realize, okay, these systemic disincentives, the data on these vaccine injuries must be so incredibly distorted across the country. I know the same thing with the residents is happening in every other hospital with neurology residents. And so what does that mean? That means that the risk-benefit ratio that everyone's making decisions on, and that the congressmen make these coercive mandates on, is just completely false information.
So you put that into real-world numbers, and I want to say one thing before I do that. I say this frequently, and you're providing more support for it, so I appreciate that. Which is that when a VAERS report is finally submitted by a physician, it is often because it's because they've really concluded, wow, that was caused by the vaccine. Because to take the hour to do it, they have to be really compelled to do it. Otherwise, they're not doing it. And that's reflective of what you just said.
And maybe a lot of doctors might think they're going to get in trouble. I mean, for all different kind of reasons.
So by the time a physician actually feels compelled to actually do it, it usually means it's, that report, and over 70% historically have come from physicians and pharma companies. But let me move away from that for a second and ask you this. Bringing that into a real world example about the risks versus the benefits. So based on the actual historical data regarding chronic hepatitis B, just as an example, amongst children born to non-Hep B positive mothers, right? The data reflects that you need to vaccinate about a few 100,000 to prevent one case of chronic Hep B amongst children, one case. So if that is, if that is the reality, to your point, it only takes a few cases of serious neurological complications, and that's just neurological complications, to be upside down and your risk benefit. 3.8 million births a year. If it's one in a few 100,000, it doesn't take many cases of harm to have the risks outweigh the benefits, which is in part why Denmark never required the Hep B vaccine, for example, for children, other than for mothers who, while pregnant, are Hep B positive.
I always thought it was kind of, a little strange that when it comes to risk versus benefit, everyone weighs that with their medications. I spend most of my visits when I want to prescribe a medicine to someone sort of trying to sort of convince them that, no, really the medicine's safe. This is actually one of the safe ones. The risks are very small. The benefits could be potentially very big for you. People are very skeptical about medicines, certainly more these days. But when it comes to vaccines, it's almost like that calculation goes out the window. But why? You still have to weigh risk versus benefit. And that's unique. The risk versus benefit is unique to each individual person. But that's not how vaccines are operated in this country. It's one size fits all. They jam it down your throat, and then they don't tell you any information. They just say, actually, not only do they not tell you, but ask any mom who even asks a question to the pediatrician, not just the last couple years, but at any point, and they'll say they make you feel like you're an idiot. That's what they say. Make you feel like you're an idiot for asking a question, and they talk down to you, and let alone forget informed consent. They even asking a question. So if they'll kick you out of your office if you don't get a vaccine and you can't go to public school, does that sound like really you're getting informed consent? So,
right, that's destructive because they've informed you, you've chosen not to consent, and then to say, well, but now we're going to punish you. You can't go to school. That is antithetical. That's called thuggery, bullying. It's the worst kind of behavior.
You can't even come back to the office where the doctor is.
To your point about risks, for those folks who you saw have a serious neurological complication, their risk apparently was 100%, right? So for some folks, it's maybe close to zero. And for those folks, it's 100. But to your point, in the same way that some folks don't want to report it to theirs, there seems to be just this antipathy to want to identify who could be susceptible. It's like there's just no regard to want to save these people. I'm all for protecting people from infectious diseases. We should protect everybody. But why does it, it is, I know why. But there is such almost a disdain to even think about trying to protect those who'd be seriously injured, who you've been treating, which is part of why I call it a religion, as you know, and religion of vaccinology. Let's just maybe make sense to just go over the neurological conditions themselves. You've gone through a few of them. Are there any others that you've seen from vaccination with regards to, in your practice?
So essentially, those are the main ones. I mean, we touched on them, but just to give you a little bit more insight. So when someone has, encephalitis,
again, brain swelling.
Yes, when someone has inflammation in the brain, because their own immune system has crossed over and is not only attacking, say, the vaccine, or in some cases, it doesn't have to be a vaccine. There are other causes, certain types of infections and things. But, I thought was, just go back for a second, in medical school, when you learn about these conditions, because you do learn about them certainly, and it says in these textbooks, in every medical school across the country, for example, Guillain-Barré syndrome, number one and number two cause. One is a sort of a rare GI infection bacteria, which could set off the immune system. And the number two is vaccines. And when I first saw that, I remember I was sitting in school looking at that saying, wait, okay, the number one is the very, very rare bacterial infection in the GI system. And wait, number two is the thing we give every single person. And I'm like,
how often have you seen the GI one?
It's always they always list it like
No, they list it as one.
Oh, I've never seen it.
Have you ever seen it?
No.
Never?
No.
But the vaccine, you've seen many. Okay.
Right? So I remember looking up vaccines. I thought it was a mistake, number two. It's not like number 8 or 9. It's like number two. And so
it was surprising when you saw it in medical school.
Yeah.
Maybe also surprising that it's not 2, it's apparently 1.
Yeah. So they ask, even on your boards, they always bring up, they say, they want you to remember this Campylobacter jejuni infection, right? And so they always make you, recite that bacteria, right? They always ask that question. Never once was the answer in the multiple choice that it was a vaccine. So. Okay.
So when an encephalitis, right, can lead to encephalopathy, brain damage, right? And many of the vaccine package inserts, the manufacturers themselves disclose it can cause encephalitis, encephalopathy. You know this already. When a child's brain is swelling, especially a baby, what can it cause? Can it cause seizures, disorders? Can it cause some kind of emotional processing? Can it cause behavioral issues later? Can it cause any type of neurological deficits? A whole spectrum of which can arise later in childhood. Could it cause ADHD? Meaning, when you are presented with that individual, that patient, and they've got brain swelling or brain damage, do you know in that moment what the sequel will be down the road?
Well, no, and nobody does. Now, I'm an adult neurologist, not a pediatric neurologist, but they don't know it either. Trust me. But what I can tell you is that when you're talking about a brain, the brain is developing until you're 23 years old. When you're talking about a brain that's 1 year old, right? The amount of neurons at that phase of development, there is explosive growth of neurons and what we call pruning of those neurons, and to basically make the brain be set off on the right course for life at that stage. It's such a delicate balance. So, I didn't even know if we were going to be able to get into this stuff, but I can tell you that I sort of shudder at every time I have to think about likely what is happening in the brain at that age when they have developed encephalitis. Because the idea that you can induce encephalitis, when I see what it does to adults, 30, 40, 50 years old that get encephalitis, how they get psychotic. They have seizures. Sometimes they get extremely sick and they die, right? So if you have that happen in a 1-year-old, and what's happening in their brain's on fire, basically. The idea that you're gonna say that that's not gonna be some, lasting sequelae that could dramatically affect their social behaviors, their cognition, their mental health. I don't know how you can get away with saying that.
So you're saying swelling the brains of little kids is not a good idea?
But the worst I think could possibly happen, I think.
And when you look at the vaccine schedule, most vaccines, in fact, the majority of them almost, are given at 2, 4, and 6 months of age. I assume it also complicates things that those little babies can't speak yet and express their symptoms and describe what whether they're having dysautonomia, whether they're having neurological complications. That's, I know you're not a pediatric neurologist, but what you're saying is it's highly concerning because we know they can cause brain inflammation. We know that can have some really downstream harms.
Mm-hmm. It's almost implausible to me that, we use the A word, autism spectrum disorder. It's almost implausible to me. It's one thing to argue about how many cases, or basically, is it only in the regressive form of autism spectrum, or is it in other forms? But to say with sort of indignance that that vaccinations and encephalitis happening at 1-year-old can have permanent and traumatic consequences that look like autism spectrum is like it's flabbergasting, because I've seen it mimicked in adults, the same symptoms.
Let me ask you this then, doctor. So would it be reasonable would this be reasonable to say that in 1986, a child following CDC schedule would get 3 injections on or before their first birthday? A child following the CDC schedule as of the beginning of last year would have gotten 29 injections on or before their first birthday. Then it became 25, and now it's 19. Okay. During that same period from the 80s to now, a whole host of neurological disorders in children have exploded, right? And there are all kinds of new ones that have arisen. And they don't know the etiology. They don't know what's caused it. Is it possible that the etiology is from the increase in the number of childhood vaccines?
From my point of view, from everything I've seen, of course. I mean,
it's likely?
Yeah, highly likely.
That is the cause.
Highly likely that in at least a subgroup of individuals who have that reaction, yes. That from everything I have seen in training, in residency, not only that, but there are studies that I've really after seeing all this, certainly I've done a lot more research on my own, and I've seen many studies which show that children with autism, especially regressive autism, will have their autoantibodies. They carry different profile of autoantibodies than other children, and that's one thing. And then there's even some information saying that there are maternal autoantibodies in moms that you can see that are quite high in children of autism. And could it be potentially that even vaccinations in a pregnant mother could cross over and cause problems? Potentially. I mean, but to say, I don't know that's the reason, but to say that that it's not is really a stretch.
Well, in ADHD as well, for example, there are markers of various immune dysfunction, as well as numerous other neurological issues. In fact, and I've written to Congress about this, and when I've testified numerous times, laying out all of the chronic diseases that have exploded, many of them, and how most of them have an etiology in some form of immune system dysregulation. And as you know, the immune system and the nervous system are very intertwined. And, Occam's razor, the most likely explanation is whatever you're doing to really modify the immune system. It's particularly troubling, and I assume you find this as well. I know you're not a pediatric neurologist, but you might be familiar with the fact that some of the milestones for what babies should be achieving at certain ages have been moved over time. And so what would be causing that? I mean, it comes back to the same issue.
Well, sorry.
Please.
If just to go sort of back to fundamentals, if you zoom out a little bit, what I see actually is there's sort of this dichotomy, this divide where, I think this idea, there's a fairly large group of people that think that the debate is really like either that vaccines either can hurt you, or that they, and that people who think they hurt that they could hurt you in a serious way are just crazy, or it's like one of the most of the people, I feel like it's not like they have a nuanced conversation. It's sort of the idea that like vaccines, that they don't hurt you, and the people who think they do or hurt you in a serious way, it's like really a sort of a fringe idea, right? But my point to everyone listening is that that's not actually, we know they hurt you. We know that they hurt you. Beyond the shadow of a doubt, they cause these conditions we're talking about. You want to debate how often and the percentages and so forth, then you can have that debate. But it's not if they can or if they will. In fact, there's so many lines of evidence proving this beyond all shadows of doubt. I mean, if you look at, for example, if you go 2010, with the vaccination for swine flu, the pandemics, whatever it was, they were causing narcolepsy in people, right? And the mechanism was quite clear. You're this molecular mimicry, the antibodies are going after the vaccine, also the brain. It's attacking a part of the brain that creates, that has the orexin receptors, that has to do with wakefulness. And they were literally inducing narcolepsy permanently.
What's narcolepsy?
So narcolepsy is when the neurons in your brain that handle sleep and wake cycles are not working normally. So it's sort of like, do you ever see that show, the movie Deuce Bigelow or whatever?
Yeah.
Okay.
Deuce Bigelow, Male Gigolo.
Yeah. There's a girl, there's one of the girlfriends like just drops all the time, and then they're like, oh God, she drops her head in the soup. It's that kind of stuff.
That kind of stuff. Okay, got it.
But that's, severe, but that's actually what it is. So they actually caused narcolepsy, and I think it was Glasgow Smith Kline, or they pulled the vaccine for that reason. But it's just proof of concept, so to speak. I mean, for people.
Well, the GBS is proof of concept. Transverse myelitis, the other conditions you mentioned, because those are not contested in the medical literature.
True.
They admit that vaccines can cause them, as you said. Even in medical school, they admit it as the second cause, apparently, from the first cause.
Yes.
But the thing that they'll do is they'll often discount the rate, or they won't really want to give it its due because they don't really want to study it.
But the second piece, what I was going to say, the second piece of that is where this is going is obviously you have to be, there's genetic susceptibility like anything else, plus the exposure. But they should have done it 40 years ago. They should be looking at, and I want to talk to you about this on the camera, but they should have done this 40 years ago instead of now we're stuck with not knowing any of this stuff. But they should have looked at vaccine injuries 40 years ago, and they should have looked at the genetics of those people, and we'd be in a very different place now. But they looked at it for that, and they saw that they nailed the gene for that. They nailed the gene. They know exactly the gene that if you had it, you get narcolepsy from the shot. And we know more genes now. Now, we should be way ahead of it now. But that's where this has to go.
Are you saying that there is existing science to identify via genetics who might be susceptible for which neurological issue from which vaccine?
Nowhere near being that specific in that case. Because
in that case, you're saying they could have.
And they can now. But where's the incentive? Where's the money? Where's the program to do that? Right? They could have done it. We could have been way ahead of it now.
You're saying that in the same way they were able to figure out there, if they deployed resources, they could identify the children that could be seriously and adults seriously injured by these products genetically.
I mean, doesn't it make sense that they could if they figured that one out so quickly? And but we do know some things, but it's stifled. Why aren't we like getting that information? We have 23andMe, and we have
Who's got the economic interest to do it?
That's right.
I mean, you said it right yourself. That nobody has the economic interest to do it. I mean, if there was a billing code for it, and the hospitals and the pediatric offices could charge for that testing, they would test everybody. But there's no code for it, and there's no incentive to do it because it would probably also breed hesitancy. Go back to the autism point since you brought it up, and obviously, when you bring up the A word, especially as a physician, I know you need to be careful. Autism is just, as you know, psychiatric a diagnosis, a DSM-5 diagnosis. And so that saying autism doesn't mean you know what caused it. All you know, something has gone wrong with the brain. And I think to your point, this is what we were talking about earlier. If you swell the brain of a baby, how it manifests later, what is the injury that arises, it could be a whole host of things. It could be what are the symptomatology that fits the autism diagnosis, plus seizures, plus some processing disorder, plus some other issues. And obviously, as you know, autism is often comorbid with other neurological harms, right? So it's almost like this. It's like if you have, if you swell the brain, something gets damaged. How it manifests might fit certain diagnoses. And to your point, why couldn't vaccines cause that? The case of Hannah Poling and other compensated cases reflect that. In fact, there are situations where it's really hard, where effectively it was conceded that vaccines caused a child's autism.
But they call encephalitis and they close the books on it. That's basically what they do, right?
Well, there's an article in PACE Law Review, Mary Holland and others did it, where they reviewed all of these cases of compensated in the Vaccine Injury Compensation Program. And what they found was that kids who were compensated with all the comorbid conditions with autism, as long as they didn't use the word autism, they used the word encephalopathy, they were compensated. The underlying medical records reflect they had autism. So as long as you don't use the A word, you could potentially get compensation. All right, tell me this. So how, because this is always, we'd say, well, causation hasn't been proven, okay? How do you prove causation between vaccine and a certain injury?
Well, there's a number of lines of evidence, right? So when we would see a person that came in has Guillain-Barré or encephalitis in the hospital, we do a lot of things. First of all, not only are you sending their blood out for very extensive testing to look for signs of infections or paraneoplastic, meaning looks for signs of cancer or other rare conditions or mimickers of these sorts of things that could sort of mimic looking like Guillain-Barré, but could be something else. We exhaustively search. We do neurodiagnostic testing, EMG, nerve conduction studies. We do MRIs of the brain and spine, high resolution MRIs with contrast. And then I would do spinal taps on these patients. And I would get the cerebral spinal fluid and I would send it out to the lab. But they don't just check the typical things that you get if you're worried about meningitis. They go out and get extensive testing. In fact, the hospital testing that the hospital can't even do in-house. Has to go to Mayo Clinic and some other places to look for some very sort of rare conditions, just to check all boxes, right? And for that reason, plus the timing of the vaccine. Now, mind you, there's a certain window of time in which the adaptive immunity, if it's going to launch that attack, is going to happen. So we have the clinical symptoms, we have the neurological exam, we have the time window for the vaccine, we have no other cause, we have the cerebral spinal fluid. We go through everything, and that's how we know. I mean, there was none of the cases I talked to you about, was there ever a question as to whether the vaccine caused these cases or not? That was never even a question, not in rounds, not by attending. It was very clear that we knew that that's what happened. But the problem is we didn't even get into the reporting systems yet. But even the active systems don't catch it because when you go into the emergency room, right? Those emergency room doctors are certainly not coding these things as those conditions. They use what's called R codes, which is they just describe symptoms like. They'll say numbness, weakness. Most of the codes are actual diagnoses. But the ER doctors, you can use codes for symptoms if you don't know what's going on. And these are complicated situations.
So they're not coding it GBS.
No.
Not coding it transient
No,
myelitis.
not initially. And these so-called active reporting systems that say that they're going to catch anything because they don't rely on anyone reporting. They just look for the code, and then the machines, the systems can look back and see if there was a vaccine. And this way, automatically, they'll pick up of a vaccine.
So just so I can unpack that. When you say active reporting systems, you're talking about the ones at the FDA and the CDC. At the FDA, that's the BEST system. At the CDC, they have the VSD system. That's what you're talking about.
Yes.
And they claim these systems are going to, help identify if a vaccine causes an injury, and they use these billing codes that you're talking about.
Yeah.
But if they're not coding GBS, that system's not going to pick up the GBS.
That's garbage data in and garbage data out. So
you don't think these surveillance systems are fit to purpose?
There may be some areas in medicine where they're better at picking up certain conditions, but I think these more complex presentations, neurological presentations, these types of conditions, by the time it gets ultimately coded as this or that, specifically, encephalitis or Guillain-Barré, it's after, a lot of workup has been done, and I doubt that these surveillance systems are picking.
And
these
it's
things
temporally at that point
Yes.
very far removed from the vaccination.
Could be.
If the system is even trying to make the connection.
Could be.
Whereas in the clinic, in the hospital, everybody who's the attendants, the physicians, they know.
We
it's
know.
from the
We start
vaccine.
treatment right away.
But they're not coding it as being from the vaccine. Right? There's no code for that, I'm assuming. Or is there?
Well, so to my knowledge, certainly I've never learned that there is one. But I went digging to see, could someone even code something as a vaccine induced? And there is a code, apparently. I don't know anyone that's ever used that code.
Vaccine induced, like...
Yeah, Guillain-Barré or vaccine induced.
But nobody codes that, as far as you know.
No, and it's like about 19 decimal points long. It's like I don't think anyone knows that code.
I didn't even know that code exists until you just told me. And I've been doing this for a long time. Nobody's ever told me about that code. Okay.
But they'll claim that they don't necessarily have to rely on you saying the vaccine induced. The active surveillance systems, what they claim, the FDA and CDC, is that their system will just look for any Guillain-Barré or any numbness.
Let me tell you how the systems often work and why they're junk as well, including for your reasons. What they'll do is, for example, let's say they're looking for GBS after X vaccine. You would think they would compare people that got the vaccine to people that don't, right? No. Or at least you would think they would compare a time period before the person got the vaccine to a time period after the vaccine, right? No. What they'll do is they'll say, okay, got the vaccine, and then in the 14 days afterwards, what is the rate of GBS? And then for the 14 days after that, what's the rate of GBS? Oh, no differential? No problem. But to exactly your point, who knows when they finally get coded for GBS? And it's nonsensical. Now, you've just brought into reality actually something I've actually written about, which is you don't know when it's going to get coded. That's not a way to do it. Why not at least look before and after? Because those systems are not designed. Those systems are not designed to assess whether the vaccines are safe. They're designed to give the public assurance they're safe. They're not really trying to find problems. And you're reaffirming that. So, okay. So have you ever told anybody over at the federal government, hey, the systems are not doing what they should be doing?
I did. I contacted the FDA about this very issue, and I said, guys, listen, you should know that people get hurt by these vaccines very badly, and I've been one on the front lines. I've diagnosed it. I've done the lumbar punctures. I've treated them. A lot more people are dying and are hurt than you realize. And I think that the statistics don't ever seem to bear it out. So it's because reporting systems are junk. And unless you fundamentally change them and remove the disincentives for the reporting and so forth, then whatever system you're going to come up with is not going to make a damn difference.
Was this on the phone, Zoom, in person?
So I went down they invited me down to the FDA headquarters in Virginia, right outside of DC. And so I went there. and I had a meeting with them, and I told them
And all
exactly
right, so
that.
you told them this issue. I mean, and are they going to do
Sort
anything?
of like we'll take it under advisement, and well, no,
Yeah.
they said that they'll have a follow-up meeting and so forth, that they have to sort of review things, but
How long ago was this meeting?
the meeting was about a month ago.
Okay. Well, if they ever change anything, we'll have a follow-up conversation. I'll believe it when I see it.
I just want to make another point here, and that is lately you've seen that there have been a couple of doctors, and thank God there are finally some who feel a little more comforted in the current environment to come out and talk in public about maybe being more skeptical and learning about the risks and benefits of vaccines, and not just accepting it as just without any kind of education and just getting them no matter what, and that's great. But what the reason that I really wanted to come out and talk to you today was because when I'm sitting here watching these interviews and the doctors talk about the pediatricians and so forth, the couple of them that do come out in public and talk about it. And what I realized is that they've never seen it, what I'm explaining to you. They've never cared for patients with these side effects. They've never been there, not because they don't want to be, but I'm going to tell you that when these events happen in the hospital, they don't call the pediatricians, they don't call the internists, they call the neurology doctors because they're having a neurological crisis in the hospital. So we take them from the emergency room, we put them on our service on the floor in the hospital, neurology service, and then we take care of them until they get discharged. And so what I'm saying, we're the neurologists. Why no one's going to speak out? I know they all saw what I saw. No one's going to come out and talk about this. And so I felt like the message is great, but I just felt like they will never be able. Those doctors are not going to be able to express what I'm explaining to you because they have an idea and they're open-minded that there are side effects, but they haven't seen this in Guillain-Barré and transverse myelitis, encephalitis, and people dying intubated from these vaccines. It's us. And so that's why I said I got to talk about this, because I'm waiting for someone to come out here and talk about it from that's a neurologist, and I haven't seen it.
Well, you're very brave to do it. And if every neurologist spoke out the way you are, we could actually start fixing this issue. Do you think there'll be repercussions from you speaking out to you?
No.
I hope so. I hope that's right.
Because quite frankly, I think that there's really nothing that could be said to impugn anything I'm saying. This is black and white. I'm not here with some other motive. I'm not selling some kind of vitamin or program or supplement or care plan or there's nothing. I'm not selling anything. This is me.
Nobody's paying you to do this.
No.
You're doing this purely because you know that if you don't speak out, how's this information ever going to get public?
That's right. And certainly in this environment, things are certainly, the pendulum's swinging in a better direction than it's ever been before. The fact that anyone's talking about this is something I thought would never happen. But I figured that there's a forum to do it, and I had to be part of it. So
let me see if I can encapsulate this, if I may. You're seeing all of these neurological complications for the last 11 years, serious complications arising from vaccination over and over again, right? Okay. The other doctors who you work with are seeing it as well, but they're not reporting it to VAERS. As far as you know, this is the same thing that's happening in the neurological departments of hospitals across the whole country, right? The surveillance systems are not picking it up because they're not designed to pick it up the way that they operate right now. You've even met with the FDA to try to fix that part of it. And so the doctors are not speaking out. The doctors are not reporting it to VAERS as they should. The surveillance systems at FDA and CDC are not going to pick it up. And so from my perspective, you're right. Unless you literally are here right now, sitting in that chair, telling everybody about this, how would they know?
No, and I say no to I get asked to go on podcasts. I say no to all of them. This one I had to do because of who you are, and because of the fact that you're making some mountains move, and you needed to have this information, and so that's why I'm here. And look, and I want to say, everyone bashes the pediatricians. They're in pharma's big pocket and all that. And I got to say, it's not always. In fact, maybe more than likely, it's not that that's not what's going on necessarily. A lot of pediatricians are well-meaning. They genuinely believe that they're this risk and benefit, that they're doing what's right. And I think that goes back to, because I have lots of friends that are pediatricians. I went to school, a lot of people became pediatricians. I know they're not being evil, geniuses in their lab trying to poke people, get bonuses from Blue Cross Blue Shield. I know, but if you follow the pathway through medical school, through residency, you don't see these things. You get taught what you're taught, and then you go into practice and you give vaccines in the office, right? But when the crisis and emergencies hit the fan, I'm telling you that we do see it. It's just not, the communication isn't happening, and there's reasons, but.
Well, I can certainly put you in touch with other physicians who are aware, but I will say this. Almost virtually none of them will speak out. Meaning, what you're doing is, it shouldn't, publicly stating what you're just seeing in the hospital, in this instance, really is an act of courage. It is, because I can't tell you how many physicians I've said, will you speak out? I was talking to somebody not long ago who was telling me, he was telling me how, they have a lot of, it was actually a hospital system in New York. I won't say which one, but he was telling me how many of his colleagues air squirt their flu shots every year. And they just write it down for each other that they gave it, even though they don't take it. They know, obviously not all of them, many of them, but many of them know to some degree, but they're not going to. And there are different degrees. Some are willing to, be experts in the Vaccines Compensation Program. And then some, a very, very, very few are willing to actually speak out public. So I really appreciate they do that. To your point, there are physicians that are doing that now, that are beginning to speak out. And obviously there's always safety in numbers. So I sure hope that other neurologists out there who see what you see, who are watching this, are going to also be brave like you and speak out and just say what you've seen. I mean, if you want to help your patients, first way to address a problem is to recognize there is a problem. Until that happens, at the least, okay, they don't need to go on podcasts, right? At the least, let them, file VAERS reports. If you see file VAERS reports, right? Contact the FDA, contact the CDC. Actually do some of the basic things that you could. Bring it to the attention of the hospital. Hey, what's that code? I'm gonna tweet that code out. I want to know that code. I'm gonna tweet it out. Doctors start using that code. So have you started using it?
So no, we haven't used it because, first of all, our system doesn't even populate it when we put it in, but it exists. It's just,
Or you can't get it to come up even when you search.
Yeah, but it's supposed to exist.
Well, is it, if you use that code, is the hospital going to get a lower or less or no reimbursement or less fees from insurance?
I actually don't know that answer.
Yeah, well, maybe that's why it doesn't populate. And I guess that's something we'll look into it after this discussion. I think that whole discussion really just feeds us into, the question of informed consent and ethics. And I think you're highlighting why probably most patients, certainly they don't get to have real consent, because consent requires, I say no. And if I say no, there's no punishment. So there's no, mandates destroy consent. But even on the informed part of informed consent, you're highlighting how patients probably aren't even getting really informed properly about the risks and benefits.
No, and I know, even just being a human being and talking to my friends and family and colleagues, and sort of when they go to the pediatrician, there's no risk being told. In fact, there's no semblance of an informed consent really happening. I do informed consent. I do a lot of procedures. I do different injections. I do different things for patients. And you used to see the triplicate esque forms we do, and we explain everything in detail. And patients, rightfully so, question us about, you sure I need this procedure? Well, can I just take the supplement from the grocery store? Can I, right? And I'm glad they asked those questions. But guys, why don't you ask it about vaccinations? I mean, these things have profound effects on your nervous system, on your immunological system, and God only knows really. I'm not even speaking about chronic issues that people develop. I don't know those answers. I know the acute, what I see.
Right.
But like, listen, everything is benefit versus risk. That's always the calculation for any medicine or procedure. That's always the calculation. It still applies to vaccinations, but I know pediatricians aren't having those conversations.
I'm going to do a shameless plug right now. And I'm going to say that I completely agree with you, which is why when a parent goes, they'll spend hours trying to decide what car to get, what car seat to get, what stroller to get. Go down the list of products that they consume. But when it comes to vaccines, to your point, a lot of times they don't give it a second of thought. They just go along. And the most heartbreaking situations we often deal with at our firm when folks call us about vaccine injuries are those parents. They're not even angry at the government. They're not angry at the doctors even. They're angry with themselves. They said, how could I not have spent a minute looking? I didn't even spend a second. I just said yes to let them inject my kid with not 1, not 2, not 3, not 4, not 5, not 6, not 10, not 7, not 8, 20 injections in the first 6-month life, 25 injections. I didn't even ask until boom, one of them the kid suffered all kinds of sequelae. And so my shameless plug is, it's part of why I wrote my book, Vaccines Save Men, because I want to make sure that, that is your ability for everybody out there. You want to look at a crash test report before you buy a car? I wrote the book so folks can get that information, but you don't need to buy my book to get that. You can also go to ican'tdecide.org, and on their website, they got a 1-page summary in the Get Informed section, a 10-page summary, a 30-page summary. That's all free, amazing information. And that, to the doctor's point, gives you an opportunity to get some basic information. So you're also equipped to ask some basic questions too. And beyond my book or ICANN's website, there are other sources out there. So, wherever you do, get informed. Don't inject blindly. It is in many ways a shot in the dark, isn't it?
It is. It's exactly that.
Well, is there anything else that you'd like to share or talk about? You came all the way out here, and I so appreciate you coming and having this conversation.
No, well, yes, and that is that. Listen, last time I checked, this is still America, and if you weigh you absolutely should, as a parent, be able to weigh the risk and benefit to your child to have a vaccination. And if you don't want one, then you absolutely should not have to give one, and that shouldn't be held, coercively against you by not allowing your child to go to school, or in fact, I looked this up actually. The AMA says that just simply alone, not vaccinating, is not. Pediatricians will say that we don't want the kids into our office because they're going to hurt other children. It's nonsense. But the AMA actually says that they're not supposed to do that purely based on that decision. That's not enough to ethically absolve them. That children that should be able to go to the pediatrician whether they're vaccinated or not. And yet the pediatricians will come out and say that they're on the higher horse here, or the better side of history or something, that they know that this is the right thing to do. When in fact, it's not. It goes against their code of ethics. And it's very upsetting when I hear that in New York, where I live, it's very, I have patients who come in and say, doctor, you don't understand. Can you please sign this form to get a medical exemption, right? And in New York, right, they say they have medical exemptions, right? But the medical exemptions are not based on what the patient's doctor says. It has to be cleared by the city's doctor. Okay, that's one thing. Secondly, they decide the certain conditions that a doctor has to sign off on to say whether or not that it meets their criteria, not if your doctor's own discretion. So, all along the way, even if your doctor thinks it's appropriate, and isn't worried you're going to get in trouble, and you find a doctor who's going to fill that out for you, that they have a number of things along the way that block it from happening. And not only that, but they make it impossible because let's say that on the record you have one of their few, and you'd be amazed at what they still consider not counting for an exemption. For example, you yourself could have had Guillain-Barré syndrome from a vaccine. It doesn't exclude you from another vaccine. I mean, can you imagine going through that and them telling you still have to get the vaccine? Is that crazy? Or you could have an identical twin sibling that had a horrific accident from a vaccine. Doesn't matter, you have to get it when we know the genetics are there behind it. I mean, but putting that aside for just a moment, they will actually, let's say you finally, the doctor writes it, you meet all the criteria, they say, okay, that counts as the one exemption for the one vaccine, but you have all the others you still have to get. So they make it impossible. And the fact that they're allowed to continue to do that, certainly in New York, is just an abomination. I mean,
when you're trying to decide on whether a patient should get a particular, let's say, surgical procedure, you just use your clinical judgment, right? Are there any restrictions that are imposed on you by the CDC on whether you should do the surgery, or allowed to do the surgery or not?
Of course not.
Yeah. So, and when you prescribe a drug, you use your clinical judgment.
Of course.
Right. Meaning you take the over a decade of experience as a neurologist, the hundreds, thousands of patients you've seen, you take that collective experience and knowledge and you apply it to the patient in front of you to care for that patient, right?
That's right.
And use your judgment to do what's best for that patient. And you can do that with any drug you prescribe, any surgery you engage, anything you do, right? And you're in the middle of a procedure, you don't there's no restrictions in the CDC, right? But when it comes to vaccines, you can't do that. Is there anything else in medicine other than vaccines where you can't do that?
Not even close. No.
Right. But even if you think the vaccine will cause serious neurological complications, if it's not on that ridiculous short list of contraindication precautions that's put out by the CDC, you're not allowed to write a medical exemption, are you?
No. And even if you do meet it, doctors are scared to fill it out because of what's going on.
Get to next.
Well, yeah. What's going on in certain states like New York, where they target physicians and they make examples out of physicians and they take your license away. So no one, even in the circumstance where they're trying to protect your child from getting hurt, and they meet all the criteria, good luck finding someone who'll do it.
Family or the child's in a wheelchair from a vaccination and they wouldn't let him back into school afterwards if he didn't get more. This is the type of tyranny we're talking about. So the first part of what you said about rights, amen. I completely agree. Well, unless your heart compels you to share anything else, because I know this is.
No, we could talk for hours. I know. Yeah. No,
I gotta say, I'm gonna reaffirm what I said. I really appreciate, and I will say that you're a credit to your patients and a credit to everybody in America who is looking to make a good decision when it comes to these products. I agree with you. Most doctors, pediatricians, and otherwise, they're not bad people. They mostly just, when it comes to these products, they just don't know. I've deposed many pediatricians. I can tell you, they don't know. In fact, I've deposed pediatricians where I've established that they have written prescriptions. They don't actually inject them. They let the nurse do that, right? They don't do the dirty job. But they've prescribed, written that for tens of thousands of injections. And when I say, okay, what are the precautions or contraindications to not administer this vaccine? They don't know them. They don't even know them. They don't know that by heart. They know the schedule by heart, to your point, but they don't even know that. So, one could say, well, that's nefarious, or it's just not part of the training. It's just not the way they view it. Safe, effective, everybody should get them, and that's it. And so, it's a credit that you've, one, actually not shut your eyes to the fact that vaccines are causing these harms, and two, are sitting here affirmatively. You wanted to bring this to the public to let everybody know that this really is an issue, because identifying it as an issue really is the first step to fixing it. So thank you very much. And I appreciate you coming out.
Thanks so much for having me on.
Thank you.